Clear cell renal cell carcinoma is the most common malignant tumor of the kidney in adults. It is also sometimes called conventional or classic type of the renal cell carcinoma or Gravit's tumor, but those are historical names and they shouldn't be used anymore, so clear cell renal cell carcinoma is preferred name. Most of the cases of renal cell carcinoma is associated with VHL gene mutations. VHL is an abbreviation which stands for von Hippel-Lindau disease. The carcinoma typically consists of clear malignant tumor cells arranged in the solid alveolar or acinar pattern. So on higher magnification we can see these cells with a voluminous clear cytoplasm with quite round or slightly irregular nuclei. And these clear cells are arranged in the small solid nests, which are encircled by the small capillaries. So this is the capillary with endothelial cells and erythrocytes inside of the lumen. And here we have the malignant cells in the small nests. These nests can sometimes resemble alveolar-like structures. So, for example, here we can see something that looks like a lumen, and therefore it is also described as alveolar or acinar pattern. The tumor should be graded based on the nucleolar appearance, and we have so-called ISUP grading system. So grade 1 tumor is the tumor associated with inconspicuous nucleoli or absent nucleoli. So if most of these nuclei don't have a prominent nucleoli, that can be called grade 1. Here we have the example of these cells, and they should be assigned to the grade 2 ISUP grade. If we have really prominent nucleoli, which can be appreciated in the low magnification, that is grade 3, and extreme nuclear pleomorphism associated with multinucleated giant cells or sarcomatoid appearance or rhabdoid change of the tumor, that should be called the grade 4 ISUP grade of the renal cell carcinoma. Renal cell carcinoma is typically associated with vascular type of metastasis, which is kind of unusual because most of the carcinomas go into the lymph nodes. So this is one of a few exceptions, together with choriocarcinoma or papillary carcinoma of the thyroid gland, and renal cell carcinoma very commonly can metastasize into the renal vein. If the tumor is small, well circumscribed, and limited to the renal parenchyma, then it has quite good prognosis after resection. Thanks for watching.